Welcome to the Functional Medicine Radio Show with your host, Dr. Carri Drzyzga, known internationally as the Functional Medicine Doc. Dr. Carri is committed to helping patients find the root cause of their health problems and fixing the cause with natural treatments so they can feel normal again. Dr. Carri is the founder of Functional Medicine Ontario and is the author of the hit book, Reclaim Your Energy and Feel Normal Again. Please welcome your host, Dr. Carri Drzyzga.
Hello, everybody, and welcome to the Functional Medicine Radio Show, the only internet radio show dedicated to giving you real solutions to improve your health. Not only are they real solutions, but they're natural solutions as well, because as you know, the one and only true wealth you have is your health. I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc, and I'm committed to helping you find the root cause of your health problem, fix the cause with natural treatments so you can feel normal again, and live your life to the fullest. So today's topic is all about gut infections, and specifically we're talking SIBO, small intestinal bacterial overgrowth. I'm so very excited about today's show because my special guest is Dr. Nirala Jacobi. Let me tell you a little bit about her. Dr. Nirala Jacobi is a naturopathic doctor and is considered one of Australia's leading experts in the treatment of small intestinal bacterial overgrowth, known as SIBO, which is a common cause of IBS. She lectures nationally and internationally about the assessment and treatment of SIBO and is the host of the popular podcast, the SIBO Doctor, podcast for practitioners. She is the medical director and senior naturopathic physician at the Biome Clinic, Center for Functional Digestive Disorders in New South Wales. Dr. Jacobi, thank you so much for being my special guest today on this episode of the Functional Medicine Radio Show.
My pleasure, and thanks for inviting me on your show.
So we've spoken about SIBO on our podcast many times in the past, so I kind of wanted to address dealing with difficult cases of SIBO. And so I'm so happy to have you on because you put together a diet called the Bi-Phasic diet, and you talk about trying to figure out if the patient has histamine intolerance or not, and maybe other types of food sensitivities along the way. And I think if we can also touch on hydrogen sulfide and constipation as well, there's so many things we can talk about, but we only have a limited amount of time. So I think the best place to start would be your biphasic diet.
Sure. So the biphasic diet really came about because, I have German background and I like order. So I put it together for practitioners to really organize their treatment approach for their SIBO cases. So it's a diet that's based on the low fermentable carbohydrate diet known as FODMAP diet, as well as the SIBO-specific food guide that was formulated or put together by Dr. Siebecker. So I kind of put it together into two phases and made my own adjustments and really wanted to offer something to patients and practitioners that made it a bit more streamlined and also focused on a pretty strong food restriction initially to already affect bacterial fermentation so that when we start antimicrobials, the die-off effect, which occurs when you have a lot of bacteria being killed and you're basically absorbing their toxic endotoxins, to really minimize that. So that's how that came about. And out of that, the biphasic diet now has been downloaded virtually thousands and thousands of times and all over the world, and we get very good feedback with it. Of course, there's always exceptions and difficult cases, as you mentioned, of where we may have to make further adjustments to it. But out of that really came also my experience that, the kind of patient that I see now is not your simple SIBO case anymore. I see pretty advanced and difficult and failed cases. And so I saw more and more histamine intolerance, which can actually occur with long-standing SIBO and lots of other reasons as well. And so I formulated the SIBO histamine biphasic diet with a really exceptional nutritionist and dietitian, Heidi Turner, So we put that together and offered that as well. Both of those are free downloads.
So like you, I see a lot of complex gut cases. And sometimes I wish to have just a simple case walk through my door,
Yeah,
at this
I know,
point.
right?
And so
Yeah, I know.
that's why I want to talk about the more complicated cases. So when you have a patient that you're working with, what makes you suspicious that they might be in the histamine, in that kind of group of people that have histamine issues?
So let's kind of unpack that a little bit before I answer your question, because maybe some people just associate histamine with allergies and you just take an antihistamine for that. But you actually have about 5 different receptors for histamine in your body that's in every imaginable compartment in your brain and in your digestive tract and in your immune system. So you have lots of different areas where histamine is actually really important and serves a special function. And also, when we eat food that's high in histamine, like fermented foods or aged foods, then we normally, in a normal healthy human being, there's no problem with that because we have an enzyme in our digestive tract that's geared towards breaking down food-based histamine. So when we then start to see histamine be a problem, we don't just see allergies, we see also headaches, we can see gas and bloating, we can see constipation or diarrhea, we see abdominal cramping, we see menstrual cramping, we see insomnia. So you can see how this can be quite confusing because a lot of people have that don't necessarily have histamine intolerance. But I'd say if I see food intolerance, it's just generally somebody saying, I just don't feel good after meals, besides the gas and bloating, but I just feel I react to a lot of foods. I have a lot of headaches. That's always sometimes a clue. And, or reflux or heartburn can be associated with histamine as well. So I see a certain picture that ticks a lot of boxes, I would say.
And then to add to that, what I've seen in my practice as well, and I start considering if histamine is a part of the picture. If the patient also complains about skin, their skin is getting red or they're flushing or they have itchy skin or even hives, then my radar
for sure.
is like,
yeah,
they have histamine issues.
Yeah. I mean, you cannot really have hives without some element of histamine. That's very true. Yeah.
And so with the histamine component of your biphasic diet, can you just kind of tell us how is that different from the original biphasic
regular
diet?
biphasic?
Yeah.
Yeah.
We'll call it the original.
Yeah. Okay. That's very good. We agonized over it, Heidi and I, because the more we worked on it, the more restrictive the diet became, and so it's sort of the difference is for the practitioner, they would go more towards the histamine and SIBO biphasic diet if your patient has all of the symptoms that we've just mentioned, or especially hives, I would say for sure, because there's also a more advanced case of histamine intolerance known as mast cell activation syndrome, but that's maybe outside the scope of this right now. But so the difference between the original and the histamine diet is that the original one has phase 1 and phase 2 still be within the context of FODMAPs or these fermentable carbohydrates. And it's just like level 1 or phase 1 is basically very restrictive. And then phase 2 is a bit more generous. The histamine one really focuses on foods that are high in histamine. And as well as fermentable carbohydrates. So it combines the histamine foods as well as the histamine, what are known as histamine liberating foods, like limes, for example, or citrus can be histamine liberating, and it just liberates histamine from foods. So phase 1 of the histamine biphasic diet eliminates both histamine and histamine liberators as well as FODMAPs, and then phase 2 you're adding in histamine liberators again, and it can happen like phase 1 only needs to be maybe a week or 2. And then you can start to add foods back in. And then when you're done with that and you've identified or calmed that whole histamine response, you can transition onto the phase 2 of the regular biphasic diet.
And so one of the nice things about your biphasic diet is, as you said, with your German heritage, it's very structured. And I think sometimes patients, they get frustrated with these different diets because they're always eliminating foods, right? And then they're unsure as what they should be eating. And then on the biphasic diet, you have listed the foods that they should be able to tolerate.
Yeah, so it's divided into basically really simple: avoid and enjoy, I think it's called, or have these foods, allowed and avoid. That's it. And so, phase one is, like I said, extremely restrictive in terms of no dairy, no fruit, no starch, and basically protein and allowable vegetables. But even there, you have to be careful of what vegetables you're eating, because a lot of vegetables like celery or asparagus, for example, are very high in these fermentable fibers. And what you're trying to do is, starve, for lack of a better term, these bacteria that are overgrown in the upper gut. Now, it's important to mention that you cannot eradicate SIBO with diet alone. We know that. You can manage symptoms with the diet, but you can't eradicate them. The eradication really comes with antimicrobials, and that's done usually in phase 2.
And so in the big picture, we want to find SIBO, and then we want to treat it somehow, and along the way make appropriate diet changes. And these SIBO diets are really not meant for long-term treatment. Eventually, we want to get the patient eating a variety of foods again. That's the goal.
That's true. Yeah, that's true. Absolutely. Because we know that long-term reduction in fermentable fibers is really starving your microbiome, which is the important organ that you have in your digestive tract that performs very important functions for you. And the more limited you are, so for example, if you are somebody who eats mainly animal protein and like sort of like a paleo diet, but like a lot of paleo people just eat basically just meat and vegetables, but more meat than vegetables. And what you're doing there is you're really favoring the growth of a phylum of bacteria known as Bacteroidetes. And then you kind of like just selectively feeding a certain group of bacteria that are also known to have problems if they overgrow. So it's I think as human beings, our ideal diet is likely to be an 80% plant-based diet. And that's what I think is a healthy diet, personally.
And within that 80% plant-based, to have a lot of variety there, not just the same
exactly
8 to 10 vegetables. There's a lot of variety. Yeah,
so that's the goal. And if we can backtrack, I actually think the goal of the practitioner is not even, yes, it is to identify SIBO, but what I usually tell practitioners is to find the cause of SIBO. What actually happened here? Because, we have normal defenses that protect us from bacterial overgrowth. Otherwise, all of us would have SIBO all the time. So, and it's really up to the practitioner to identify if this patient has SIBO due to some motility defect, whether that's, having had a case of food poisoning that then triggers an autoimmune response and damages the normal cleansing wave of the upper gut known as the migrating motor complex, or that patient has hypothyroid or Ehlers-Danlos or hypermobility syndrome, or the myriad of things that can actually occur to damage this motility in the upper gut. The other area of SIBO causes or underlying causes is digestive, poor digestion, so impaired digestion such as low stomach acid or low enzyme output by your pancreas and bile output by your liver. So these are juices that are the normal antibacterial defenses. And if you have some deficiency there, then it's also a natural consequence that bacteria would just overgrow. And then there's certain medication that impair motility. And then lastly, the last category is impaired outflow. So this means that if you've had a surgery of any kind, such as hysterectomy or even a laparoscopy to look for endometriosis, or if you do have endometriosis or had your gallbladder removed or any sort of abdominal intervention, that can trigger scar formation known as adhesions that then can attach to the small intestine and kind of kink it like a kink in a garden hose. And then the food can't really flow through there very well. And it's just like a river that's run stagnant and has algae growing in it. And I usually have that sort of analogy for my patients as a visual. So really addressing underlying causes is for me now really the sweet spot, because SIBO is a natural consequence of these underlying causes, and it's really important to find the cause.
I'm so glad that you mentioned that, because in my private practice, I explain that so often to patients. Look, finding SIBO, that's relatively simple. Here's the test kit. You go do it. We get the results, and that confirms you have SIBO. That's relatively easy. Treating it, that's harder. But really getting to the root of it, that's the hardest part.
Yeah, exactly. And that, especially if it's in the motility category, I mean, if it's just low stomach acid, we know how to treat that. That's easy, right? But still there you need to rule out, is it chronic gastritis or what's really causing the achlorhydria or hypochlorhydria or low stomach acid. But I find that the motility category is getting bigger by the day. It's like we have traumatic brain injury that can cause vagal tone deficiencies that can then result in poor motility in the upper gut. We can have stealth infections like Lyme and EBV even that can trigger issues with motility. So it's just a big ball of problems, or we have to sort through that to really find the cause. I do have a free, I don't know if you've seen it because it's a relative recent release that we've released from the SIBO Doctor, is What Caused My SIBO handout. That's really for patients and practitioners to just kind of at least get the attempt to identify which of these 4 categories is best represented on this questionnaire. So that's a really good resource for people so that their practitioner can wrap their head around what avenue to take to address the underlying cause.
Fantastic. Thank you for mentioning that. So I'll make sure to find that link and put it in the podcast notes so that our listeners can get that resource.
Great.
So one of the things that I also wanted to talk about is hydrogen sulfide SIBO. So, testing for this and treating for this, so this can be difficult. So can you talk about that, Nirala?
Yeah, so hydrogen sulfide is a gas that is produced by what we know as what are called sulfur-reducing bacteria. And it's a bit of a confusing term because they reduce, the reduction refers to a biochemical term, not that it's reducing hydrogen sulfide. But so sulfur-reducing bacteria are typically desulfovibrio or bilophila, and they use a main pathway that produces hydrogen sulfide from hydrogen and sulfur. And hydrogen, as we know, is one of the gases that we typically test for in a breath test. And so we typically use methane and hydrogen to check for SIBO, methane being more of a constipation relation to SIBO, and hydrogen can be either constipation or diarrhea. So on a breath test, we can't really test for hydrogen sulfide yet. And there was some announcement by the Cedars-Sinai group this year that they have developed a test that can check for this. And but I don't expect commercial availability of this really for another year or 2 at best. So, it's sort of what we've done so far is if there is a flatlining result in hydrogen and methane on a lactulose breath test, and the patient has classic diarrhea symptoms because hydrogen sulfide in the small intestine is so toxic in high doses that it actually causes diarrhea. But in my experience and in my research, I find that if hydrogen sulfide production is ramped up in the colon, that it actually triggers constipation. So we have these 2 opposing ends of the spectrum. There's I think what we'll find is that it needs a different approach. It's very resistant to antibiotic use, typically, these sulfur-reducing bacteria, and that we also probably need a different dietary approach to hydrogen sulfide than to other types of SIBO. So, in my practice, I often, when I find it on a stool test, when I find these two sulfur-reducing bacteria on a PCR test or DNA test, that's stool-based, which is not reflective, of course, what's happening in the small intestine. But I tend to adjust the biphasic diet to add more things like soy protein, like tofu or tempeh, if they can tolerate it, of course, GMO-free, because there's some evidence that soy isoflavones are also helpful with this, and that a low FODMAP diet might actually be the wrong diet for hydrogen sulfide.
And then for our listeners out there who are new to this hydrogen sulfide SIBO, can you explain to them what symptoms might make you suspicious of hydrogen sulfide?
So classically, we've heard about this, very sort of gas that's very much like rotten eggs, which is, pretty descriptive, I'd say. It's very, very foul gas, or burping that can smell like you've just had basically like a very foul smell, is what I would say. But I can tell you that I don't always see that to be clinically there. The other symptoms can be pretty much anything that is SIBO related. It can be gas, bloating, diarrhea. If it's SIBO, it's likely to be diarrhea. If it's more LIBO, it might be more constipation. But also people have systemic symptoms like either headaches, joint pain, sort of pins and needles in their fingers. They can be super intolerant to alcohol, facial flushing, that type of thing.
So again, we start getting these very non-specific symptoms.
Yes.
And it just gets difficult to try and figure out what's going on.
I think it'll be really great when we have the ability to just add that gas on to our testing services now, and it'll be one machine that does all three gases, very likely.
And then the other thing, that will be good. The other thing that I'll ask patients to see if, I'm suspicious of hydrogen sulfide is I'll ask them if they eat a meal that has a lot of eggs in it. How do they feel? Does it make them worse? If they eat a meal that has a lot of onions and garlic, how do they feel on that? And if they eat a meal that has a lot of cruciferous vegetables. So those are all foods that are very high in sulfur. And so then I think, well, if consistently all of those things are like, oh yeah, I feel worse on those, then I think, well, maybe this is a hydrogen sulfide picture.
It's a bit tricky because, as we see egg allergy I see egg allergy then as the number one allergen, actually, that I see. I mean, egg is like a lot of people are sensitive to eggs. So sometimes people get worse when they eat a lot of eggs because they're actually quite sensitive. And onion and garlic, they flare up any SIBO case. But You're right, the cruciferous vegetables are a good source of sulfur. And typically when we treat hydrogen sulfide, we have a period, not long, a period of maybe 6 weeks or so where we reduce sulfur-containing foods, which contains things like red meat, right? So it's not just in eggs and vegetables, but it's also found in these other foods. So and then we incorporate more, like I said, soy protein, which tends to be also pretty well tolerated from a fermentation standpoint in terms of SIBO. So, but it's also important to know that sulfur and hydrogen sulfide is this really interesting molecule that it's got a Goldilocks kind of a level. If you have if it's too low, it's a problem. If it's too high, it's a problem. But if it's just right, it's actually really beneficial and anti-inflammatory and anti-proliferative and very useful because hydrogen or sulfur is one of the most important elements in our body. So it's not to be vilified, it's just to be understood in terms of we have endogenous production, meaning your own body produces it, but then you also have bacterial overgrowth that produces it. So it's again just finding the balance there.
So for the listeners out there, if you're suffering with a gut issue and you've tried everything and you're confused and you're frustrated and you're not getting better, these issues are really complicated to try and figure out. There's no one great test out here that's going to tell us everything we need to know. And there's not one treatment either that's going to be like the cure-all. It's a matter of just working through the case and just figuring it out. So, Dr. Jacobi, the other thing is that this hydrogen sulfide is hard to treat. As you were saying, the antimicrobial options are not really that helpful. Are there any herbs that you use that?
Yeah, so and it's so nice to hear somebody else say herbs, actually, because when I talk to Americans, it's all about herbs, right? Even though I lived and obviously studied in America for a long time, but in Australia we say herbs also, so that's a nice thing. So what we do is we use a very, very high dose oregano oil. That shows some promise, but there is a real paucity of herbs that have been shown to be effective for hydrogen sulfide. I think there needs to be a lot more research into that, and probably just a lot of trial and error on the practitioner side. But what we know is that hydrogen sulfide producing bacteria are really very resistant to antibiotic, and that's why it's presumed why people have such an issue with it if they've had a lot of antibiotic is because they've basically killed off everything else and hydrogen sulfide producers survived. And so what we do is bismuth in high doses. So bismuth is a binder of hydrogen sulfide, and we use oil of oregano. And there's some data on zinc acetate. I think probably most zinc that's not well absorbed would work because it's another binder. So both bismuth and zinc acetate are binders of hydrogen sulfide. So not even directly bactericidal or killing bacteria. So, and berberine is hit and miss. I'd say it's not the greatest herb, but it's one of our star performers when it comes to hydrogen overgrowth producers and SIBO. So, and of course, hydrogen is required for the production of hydrogen sulfide. So maybe in a roundabout way, we are affecting that. But directly bactericidal to these hydrogen sulfide producers is still very few herbs will do that.
And as you said, a lot of the times it's a matter of trial and error. Just see how the patient responds, what they can tolerate, what works.
Yeah.
It could be a very individual thing.
Yeah, and I mean, I do get really good responses to, I think that SIBO hydrogen sulfide might be easier to treat than LIBO hydrogen sulfide, right? So, and what I usually do is, in that case, is what I find works really well is just reducing sulfur-containing foods for a while, and just microbiome restoration, which is really with every patient I do that. I really have an intense look at their microbiome and see what I can do to basically till their garden and fertilize their garden and try to regrow some of these native species that they may have lost.
And so I'm glad you brought that up. So in the last few minutes, let's focus on microbiome restoration. What are some of the things that you do?
I'm a big fan of prebiotics once SIBO is cleared, and prebiotic is basically a food for beneficial bacteria. For the longest time, as naturopathic doctors, it's amazing how much science has validated our thoughts on the gut that have been basically dismissed for decades. That the gut is the root of the cause, and we've been doing probiotics and gut rehab for a long, long time. And to now have real data to show that what we've been preaching all along is correct, that's really wonderful to see. But really, what we've been teaching patients that to take a probiotic to reseed their digestive tract is really not right. It's archaic, and we shouldn't talk about it like that anymore, because probiotics do not replace your own native species. Like, you have your own bifido, you have your own lactobacillus, you have your own important species that even if you take a probiotic that has lactobacillus and bifidobacterium in it, it doesn't replace what you've lost. But it does have a regulatory effect on the rest of your garden. And I always tell people it's either a rainforest or a garden, whatever analogy you like, but you have to treat it like that, which means you have to feed and give it nutrients. And that's usually done with prebiotics and polyphenolic foods, or that means that it's vegetables and plants that are extremely colorful. They just love that. And that could be things like grape skin, green tea, the plethora of vegetables that are out there that are very colorful. That's what they love. And again, this is within the context of microbiome restoration, which usually comes after SIBO treatment. So that, because a lot of those foods you would react to if you actually eat them. But then I use very specific prebiotics like galacto-oligosaccharide, also known as Bimuno. And that's a particular prebiotic that is like the only prebiotic that's found in breast milk, with the sole purpose to feed the infant's microbiome, specifically Bifidobacterium infantis. Very, very important microbiome former, really. So, those are the kinds of tricks that I have and have learned over the years. And, it's a new frontier for us in terms of microbiome restoration, because there's so much damage that has been done to a lot of our patients' microbiome.
Dr. Jacobi, you are just a wealth of information. How can our listeners find out more about you?
So, I'm sort of all over the place in terms of, I've got a clinic called the Biome Clinic, and that's just thebiomeclinic.com. I'm in Australia. And I have an education platform for practitioners, soon also to offer a course for patients. It's called SIBO and there's a lot of free information there. You find the biphasic diet original and the histamine and the questionnaires that I talked about, also hydrogen sulfide diet handout. So we really just offer a lot of free materials there and courses that is on microbiome restoration and everything you can think about with SIBO. So that's a good place to start. And we're also of course, on Instagram, Dr. Nirala Jacobi, and on Facebook. So if you really want to find me, it's not hard.
Yeah, so for the listeners out there, I'll make sure to find all of those links. And we'll put them in our podcast notes so that you can easily find Dr. Jacobi and all of her resources. Nirala, thank you so much for being my special guest today. This has been an awesome interview.
Great. Thanks so much for having me. And Merry Christmas.
Oh, thank you. All right, that wraps up this very special episode of the Functional Medicine Radio Show with Dr. Nirala Jacobi. And I want to thank you, our listeners, for tuning in today. And I'd like to invite you back next time for another episode of the Functional Medicine Radio Show. As always, I'm your host, Dr. Carri Drzyzga, the Functional Medicine Doc. Have a great week, everyone. Oh, thank you so much, Nirala.
Pleasure.